That would have made the procedure easier on me would have been more support from my family.
One thing that is a tonsils removal, which is also known as a tonsillectomy.
The tonsils are a pair of soft tissue masses located at the rear of the throat or the pharynx. Each tonsil is composed of tissue similar to lymph nodes covered by pink mucosa. Running through the mucosa of each tonsil are pits called crypts. The tonsils are part of the lymphatic system, which helps fight infections. Tonsils vary widely in size and swell in response to infection.
There are many different types of tonsillitis. One is acute tonsillitis, which is when a bacteria or virus infects the tonsils, which causes swelling and a sore throat. The tonsils may develop a gray or white coating.
Another one is chronic tonsillitis, persistent infection of the tonsils, sometimes as a result of repeated episodes of acute tonsillitis.
Peritonsillar abscess is an infection that creates a pocket of pus next to the tonsils, which push it towards the opposite side and must be drained immediately.
Acute mononucleosis is usually caused by the Epstein-Barr virus. Mono causes severe swelling in the tonsils, fever, sore throat, rash, and fatigue.
Strep throat, a bacteria called Streptococcus, infects the tonsils and throat accompanied by fever and neck pain.
Enlarged tonsils are large tonsils that reduce the size of the airway, which makes snoring and sleep apnea more likely.
Tonsil stones form when trapped debris hardens or calcifies. There are many different ways to test for tonsillitis.
Throat swab. A doctor rubs a cotton swab for tests. Usually this is done to check for bacteria such as Streptococcus.
A monospot test is a blood test that can detect certain antibodies, which can help confirm that a person's symptoms are due to mononucleosis.
The Epstein-Barr virus. If a monospot test is negative, antibodies in the blood against EPV might help diagnose mononucleosis.
The main reason for having the tonsillectomy is to treat infection and inflammation of the tonsils. It is also an important procedure to have done because it helps to correct sleep-disordered breathing.
A throat doctor will perform the tonsillectomy. They must have the undergraduate degree in biology or science, their 4-year medical degree, 3 years of otolaryngology residency, 1 year of general surgery training, and 1 year of additional training. The physician also must pass the USMILE, obtain state license to practice medicine, and have their certification in otolaryngology by the American Board of Medical Specialties.
Getting this procedure done for the 24 hours before surgery, you may not eat or drink. Your stomach needs to be empty because anesthesia causes our normal reflexes to relax. After checking into the hospital or surgery center, you will be advised to change into a gown and receive an IV after completing basic checkup procedures. You will then head on to the operating room. Here they put an air mask over your nose and mouth to put you under anesthesia. After surgery, you will wake up in a recovery room where the nurse will do a post-op and eventually send you home.
Tonsils are surgically removed by dissecting between the tonsillar capsule and the superior constrictor muscle using either the hot or cold technique.
In the hot tonsillectomy technique, electrocautery is employed to dissect and coagulate simultaneously. In the cold tonsillectomy technique, a superior incision is made through the mucosal layers and a blunt dissection is used to separate the tonsils from the underlying tonsillar bed.
Tonsils are then separated along the inferior border using the snare method. New techniques use CO2, lasers, ultrasound, and radio frequency to reduce future pain in the tonsil area.
Before surgery, patients must sign a form of consent issued by the doctor to ensure they understand possible complications. These include upper respiratory obstruction, chronic infections of the tonsils and adenoids, and possible neoplasm or tumors.
Many pieces of equipment are used during this surgery. For example, the Alice clamp is a surgical instrument with sharp teeth used to grab or hold heavy tissue.
Another tool is the McIvor mouth gag, used to keep the mouth propped open during surgery.
They also use the number 12 scalpel, which is a small pointed crescent-shaped blade.
The curved Metzdaubein scissor are surgical scissors designed for cutting heavy tissue.
The Fisher tonsil knife is a multi-purpose tool that is used to easily separate and divide the tonsils from the tissue.
The tiding snares are designed to encircle the affected tonsil for removal.
The adenoidectomy curettes are a spoon-shaped tool that removes the adenoid gland.
After the procedure, there are many precautions that you will need to take.
First, your diet. Drink lots of fluids. Start with eating soft foods. Advance to solid foods as tolerated. Dairy products and drinking from a straw are not allowed.
Light to moderate activity is recommended. Lifting, straining, and contact physical activity should be avoided for 2 weeks following the surgery.
At first, the pain will be minor, but it will increase as the week goes on. Physicians may prescribe a pain reliever, and pain should improve 7 to 10 days after the procedure. Ear pain may occur, and adults tend to take longer to heal. Do not take any products containing aspirin for at least 2 weeks.
Bleeding may occur up to a week after the surgery. Rinse mouth with cold water. If bleeding proceeds, contact a nurse or physician.
You also may experience nausea or vomiting. Your physician may prescribe a nausea medication for you.
The back of the throat will appear white or yellow during the healing process. After a few weeks, the normal pink appearance will return, and temporary taste alteration may include tongue numbness and halitosis, or bad breath.
A low-grade fever is common. If the fever is over 102 degrees Fahrenheit, contact a physician.
Your voice may sound high-pitched during the healing phase.
Lastly, you may face constipation due to changes in the diet, activity, and the medications that were prescribed for you. Drink lots of fluids and use over-the-counter stool softeners and Miralax.
After my tonsil removal surgery, my throat hurt extremely bad for several days. It felt like my throat was being constantly cut open. It was not embarrassing, but very painful. One thing that would have made the procedure easier on me would have been more support from my family. Only my mom came with me, and I feel like I would have felt more comfortable if my dad was there too. This procedure definitely improved my life. Before I had it done, I was getting sick close to every month. It was extremely painful.